Hi, I'm Dr. Robinson. I'm going to be your guide in the next few PowerPoints to help you learn the nursing process. I want you to understand and remember the acronym ADPI. This will help you understand each step of the nursing process. A is for assessment, D for diagnosis, P for planning, I for implementation and interventions, and E for evaluation. Each step in the nursing process, assessment, diagnosis, planning, implementation, and evaluation, or ADPI, has a unique purpose. Each problem is then stated in standardized language as a specific nursing diagnosis to provide greater clarity and universal understanding by all care providers. Although each step in the nursing process has a clearly identified purpose, all of the steps are interdependent. Each requires information from others for adequate development and revisions for an effective plan of care. The steps overlap and require thoughtful consideration by the nurse at each transition for the maintenance and accuracy and effectiveness. So why is the nursing process important? Learning this process will help you think like a nurse. This is the foundational process of professional nursing practice. Effective use of this process is dependent on the nurse's knowledge, the ability to use and apply evidence-based practice, and their ability to evaluate the patient's responses to interventions or the care that we provide. The nursing process is a systematic method of critical thinking. It's deliberate. We use it to develop individualized patient care plans for each patient. It's used as a framework to help provide care. It involves critical thinking, decision-making, problem-solving, and we revise the plan of care as needed to help meet the patient's goal. You can see here that health is actually on a continuum. The patient will be entered into the hospital with a disease process, and we're continually always trying to reach and help the patient gain a stronger and better area of health. By using the nursing process, we're also ensuring that we are meeting certain standards of care that are required by the State Board of Nursing and guided by the American Nurses Association's scope and standards of practice. So there are several things that need to be included when you're making a care plan and planning care using the nursing process. We need to know the patient's current assessment status. We also want input from the patient because the care plan is about them. We also want to try to involve the patient's family when possible because they will be there to assist the patient. We definitely want input from our team also, the team members that are going to be working together to actually make this patient better and help them get home safely. The interventions that we're going to do on this patient will help to lead to solve the patient's goals. We also want to make sure that care plans are made specific for each patient. Standardized care plans think that the care for this certain diagnosis will cover all the needs for every single patient, which is not true. So we do not want standardized care plans. We do want care plans that are individualized to help meet each patient's individualized needs. Okay, so you are assigned a patient in the hospital. When does care planning start? I'm here to let you know that care planning starts on admission. As soon as the patient is admitted to the hospital, we start planning for discharge. We make goals, long and short-term goals, that will help get the patient to the healthiest state possible and also to get them home safely. Assessment is step one in the nursing process. Data collection begins at the first direct or indirect encounter with the patient. Specific data are collected during the patient interview, health history, and physical assessment. Nurses assess the state of the patient's physical, psychological, emotional, environmental, cultural, and spiritual health to gain a better understanding of his or her overall condition and is known as a holistic approach to patient care, meaning we are treating the whole patient, not just a portion of them. Assessment data can be collected in a variety of resources, including patients, family members, friends, communities, healthcare professionals, through the medical records, through laboratory and diagnostic tests also. Primary data consists of information that's obtained directly from the patient. Secondary data is data that is collected from family members, friends, other healthcare professionals, written sources such as the medical record, and also the medical lab tests. Subjective data are symptoms that are spoken. Patients' feelings about a situation or comments about how they are feeling are examples of subjective data. Subjective data are most often gathered during the patient interview or the health history. Subjective data may be difficult to validate because we cannot independently and objectively measure these items. Data collected from medical records, laboratory, diagnostic tests, or physical assessments are objective. Objective data, or signs, are consistent of observable information that the nurse gathers on a basis of what is seen, measured, or tested. Most objective data are collected by the nurse during the physical assessment, which includes inspection, palpation, percussion, auscultation, or direct patient care. Collecting accurate information and documenting the findings in the patient's medical record are imperative for later comparison. The documentation process helps the nurse organize patient information so that it can be analyzed, validated, and clustered before the identification of accurate nursing diagnosis can be developed. The second step in the nursing process is diagnosis. During this step, we utilize the NANDA list of nursing diagnoses to identify actual or potential problems or a response to a problem that the patient is currently experiencing. We utilize subjective and objective data to accurately identify which nursing NANDA diagnoses apply to our patient. It is important that we accurately identify and gather information properly so that the diagnosis that we formulate from the NANDA list of nursing diagnosis is accurately identified and truly represents a patient problem that the patient's experiencing. Diagnosis in the nursing process requires naming the patient's problem using nursing diagnostic labels. Nursing diagnoses are established and revised biannually by the North American Nursing Diagnosis Association International. It's a professional nursing organization that provides standardized language to identify patient problems and plan customized care. Medical diagnoses are labels for diseases, whereas nursing diagnoses describe a response to an actual or potential problem or life process. The NANDA identifies 3 types of nursing diagnoses that should be used when developing patient plans of care. Here's just a small example of some of the nursing NANDA approved diagnoses that you'll be using to help formulate a nursing diagnosis statement. You can see that one of the examples is impaired gas exchange. In the actual nursing NANDA statement, you would write impaired gas exchange related to, and then you need to put the pathophysiology of what's causing this. I'll go over this even in more depth in the next slide. But what I want to let you know and make sure that you understand that the related to cannot be a medical diagnosis. So you cannot say impaired gas exchange related to pneumonia. You must say impaired gas exchange related to CO2 exchange issues at the cellular level. Let's go into some more depth regarding how do you write a nursing NANDA diagnosis statement for your patient. You'll be writing 3 types of nursing NANDA diagnosis statements in this program. You will, based on your patient's problems, write either an actual nursing NANDA diagnosis, which contains 3 parts, a risk for diagnosis, which means my patient does not actually have this problem currently, but is at risk for developing this problem, or a health promotion nursing diagnosis. Actual nursing diagnoses are written with 3 parts. It'll contain a NANDA approved nursing diagnostic label as we demonstrated on the previous page. Then you're going to write R/T or related to, and you're going to put the etiology or cause. Now remember I told you it cannot be a medical diagnosis, so you need to open your book, your MedSurg book is preferred, and look up the etiology or the underlying cause of what is causing this current problem for the patient. And then you're going to go back and look at the things that you assessed in your patient, subjective and objective, and find 3 pieces of evidence and write AEB, or as evidenced by, and give me 3 pieces of evidence that prove your patient actually has this NANDA diagnosis. If your patient has no identified problems, you would move on to the next type of NANDA diagnosis. If your patient does have actual problems, you are required to use actual nursing NANDA diagnosis for all of the areas that you're assessing. If your patient has no identified actual nursing problems, though, you're going to move to the next level, which was risk for diagnosis. The risk for has 2 parts, a nursing NANDA diagnostic label, and then you're going to say related factors, R/F, indicating where the patient's vulnerable for developing this risk or problem. If your patient has no actual and then no risk for problems, you would move then forward to develop a health promotion nursing NANDA statement. And these usually begin with the words readiness for enhanced. Standardized lists of nursing diagnostic labels are available at the beginning of your nursing care plan book. It is a nurse's responsibility to accurately identify and use nursing diagnoses for every patient to develop patient-centered goals and realistic outcome criteria in your individualized plans of care. Patients may have multiple problems requiring a variety of nursing diagnoses. Regardless of how many nursing diagnoses the patient has, it must be considered in the planning process. Planning is the 3rd step in the nursing process. Establishing short and long-term goals to address the nursing diagnosis involves discussion with the patient and often requires collaboration with family members and other members of the healthcare team. Coordinated, team-based care is called collaborative care. The patient's primary nurse is often the central figure in coordinating collaborative care. Short and long-term goals are designed to meet the patient's needs. Short-term goals are achievable by the end of a shift, where long-term goals can be achieved within 2 to 3 days or by the time of discharge. All goals must be patient-focused and meet the SMART goals criteria. They must be specific, measurable, attainable, realistic, and timed. Goal setting creates a structure or a framework within which nursing care takes place. Goals can help to direct a patient's healthcare team and ensure that all members of the team work to achieve the same outcomes. Whenever possible, it's important to include the patient in the identifying their short and long-term goals. Once you have written your nursing NANDA diagnosis statement, you're going to want to make sure that the goals that are going to lead you to solving this problem and the interventions that you're going to perform to help solve this problem and lead you to your patient achieving their goals are in alignment. The NOC, NOC, and NIC, NIC are standardized nursing terminologies or labels focused on patient outcomes and nursing treatments. You do not make these labels up. You find them in your nursing diagnosis handbook. The outcome identification labels help ensure that the goals and interventions are addressing the same topics. If the goals are about mobility, then the interventions will also be about mobility and will be items that will help the patient meet their goals. So here's an example of NOC and NIC for impaired physical mobility. The NOC, NOC, or Nursing Outcome Classification, when you think of the word outcome, I want you to think of the word goal. So the Nursing Goal Classification is really what we're looking at here. It's just a label taken from the Nursing Care Plan book to help label what are our goals going to be about for impaired physical mobility. In addition, we're going to do some interventions or some nursing actions that are going to help us get our patient to achieve these goals. The NIC, NIC, or Nursing Intervention Classification, is an overall label of what our interventions are going to be about to help us lead to fixing our goal. So here are some examples. Impaired physical mobility, I could choose for my goals all to be about ambulation or helping the patient walk. Then my intervention should also be driven towards ambulation. So this will help to make sure that my goals are in alignment and also my interventions are in alignment to help make sure that they're going to meet my goals for this patient. Collaboration and delegation of care are integral to the implementation step of the nursing process. After the nurse has established the scope and practice and abilities of each healthcare team member, understands their unique skills and abilities, the nurse can coordinate care to benefit the patient and achieve the patient's positive patient outcomes. This will result in shorter recovery times or shorter rehab periods, reduced lengths of stay of hospitalization, and greater patient satisfaction. Implementation is the fourth step in the nursing process. Interventions may be independent, dependent, or collaborative nursing actions requiring direct or indirect nursing care. All should be derived from evidence-based practice standards that have evolved from research conducted to elicit the best patient care outcomes. All nursing interventions that are implemented for patients must be documented or charted. Many healthcare agencies have special requirements for documenting interventions, such as the use of physical restraints or pain protocols. Proper documentation of intervention facilitates communication with all team members and provides essential legal record. Accurate charting helps to alleviate omissions and repetitive care. Documentation also allows nurses to evaluate the effectiveness of nursing interventions in meeting the patient's goals and outcomes, which is the final step in the nursing process. Ethical, legal, and professional practice. All healthcare professionals are required to document the care that they provide. Follow-up evaluation of interventions must be documented to help the healthcare team determine the effectiveness of treatments, activities, and prescribed medications. Evaluation is the fifth and final step in the nursing process. During the evaluation step of the nursing process, nurses use critical thinking to determine whether the patient's short and long-term goals were met and if the desired outcomes were achieved. Monitoring whether the patient's goals were attained is a collaborative process involving the patient. Nurses need to ask some questions when evaluating the effectiveness of the care that has been provided during the provision of the interventions. Did the patient meet the goals and outcome criteria established during the planning phase? Since care began, have new assessment data been identified that should have been taken into consideration? Does the care plan need to be modified in response to the patient changes? Based on the patient's responses to the implementation of the interventions, should the plan of care be continued, revised, or discontinued? The answers to these and other questions determine how to best proceed with the individualized patient care. Cyclic and dynamic nature of the nursing process. As the short and long-term goals are met, that section of the nursing care plan can be eliminated or discontinued or modified. Sometimes the nursing care plan needs to be modified to meet the patient's other needs that were not previously identified. This evaluation process is also based on the nurse's ability to critically think about what care was given and what care may be needed in the future. The nursing process is a professional nurse's best tool for the application of the scientific method to patient care. It is an essential critical thinking method used by nurses to provide safe, competent nursing care to patients, families, and communities. This functional dimension care plan will be utilized to gather data for your patient. The topics listed here are from Gordon's Functional Dimensions, and each of the topics will be addressed in a Level 1 content lecture. Grouping the data on this form will help you formulate your nursing care plan. You will need to list the subjective and objective items that you assessed in your patient for each area of this functional dimension care plan, and then this is utilized to document your evidence for your AEBs in each of your actual NANDA diagnoses. During Level 1, you'll be submitting one of these completed functional dimension care plans as part of your formative and summative clinical preps. You'll be asked to put these boxes in order of priority for your patient. Deciding the order in which the nursing diagnoses are addressed depends on several factors, including the severity of symptoms and the patient's preference. After emergent needs are dealt with, less critical problems take priority. Let's take a closer look at each phase of the nursing process.